Hello, Supervisor Joe Simitian. I'm so pleased to be sitting here with you in the studio today on Santa Clara Valley Healthcare's podcast, The Beat. Can you tell us, for the few people who don't yet know who you are, a little bit about yourself?
Oh, thanks, Nick. Let's start with the fact that I'm County Supervisor Joe Simitian. I find that county government is not well or widely understood, so I start there. A lot of folks know me from some other level of government where I've served because I've been at this for a bit. I was a local school board president in Palo Alto and then a mayor and council member in Palo Alto as well. Did an earlier stint on the County Board of Supervisors here in Santa Clara County, then went off to the state assembly and ultimately to the state senate. So served 12 years in the legislature in Sacramento and then came home and have been back on the Board of Supervisors now for the past 10 years. Moved around a lot when I was a kid, raised by a single mom till I was 14, and then ended up moving out to Palo Alto to live with my dad and my stepmother back when Palo Alto was a genuinely affordable middle-class community, and went to Palo Alto High School and have made that my Palo Alto my home ever since. So long time in public office and at various levels, and really enjoy the work, find it satisfying, frustrating every day, of course, but tremendously satisfying. If you want to try and help make things right, you can. And if you want to make sure that others have some of the opportunities that I had along the way, you can make that happen as well.
Well, that is just so wonderful to hear. It's been a joy for me to see you both around the county in my workplace as well as out in the community too, and just see your passion for what you do and the care for the members of our community. So I love that.
Thanks.
You are no exception to why we call this The Beat. The heartbeat of Santa Clara Valley Healthcare are the people who work here, and you do that as well. So today we're going to be talking about access to affordable healthcare. Mm-hmm. I know we have many things to talk about, and I hope you'll come back on in the future. But when talking about access to affordable healthcare, I know you talked about affordability in general, but what does access to affordable healthcare mean to you? Why are you a champion for that?
Well, I guess I should say access to affordable quality health care. A few years ago, during the couple of years that I served as president of our Board of Supervisors, the custom is that there's a state of the county address. And I made the judgment one year, let's just talk about health care. For all the breadth and range of things we do at the county, I wanted to spend the time I had with folks talking exclusively about health care. And I started with an anecdote about being a kid and my grandfather, who was an immigrant to this country, saying, Joey, take care of your health. It's the only thing. It's the most important thing. And, he was really right. When I was a kid, it didn't register really. Obviously, it stayed with me for some reason. But, you're a kid, you're healthy, you're full of energy. And it never occurs to you that as you watch folks go through their lives that this is the indispensable ingredient in a happy and healthy, successful life, is that without good health care, people are going to be limited and unable really to fully realize their potential. And the access to affordable and quality health care, which, a lot of my constituents are blessed, they can take that for granted, but too many don't have that access. And so at the county, we are used to being a social safety net, and that's our core mission, and as it should be in my view. But I've been trying to push the envelope a little bit and make sure that we're also reaching out to and serving what I call the missing middle of healthcare. And these are folks who, they may not make enough to have top-rate health insurance or access to first-rate healthcare providers, but they perhaps make a little too much money to qualify for programs like Medi-Cal here in California. And so the question is, how do you keep those folks from slipping through the cracks of our healthcare system? And, part of it is price. Part of it is just geography, access. I'm the representative for District 5 in Santa Clara County, in the North County and the West Valley. Most folks have no idea nor any interest in what supervisorial district they're in. But if, I tell you it's all or part of 9 different cities and towns in the North County and the West Valley, that's roughly there I'm talking about. There was not a single county health clinic or hospital in my district. It is the only one of the 5 districts that just has zero, zip, nothing in the way of a healthcare clinic. And while it is a more prosperous area, there are a lot of folks who have need there. So, part of this is about affordability, but part of it's about access and geography. So I've been pushing, as my colleagues would be quick to tell you, on making sure we get access. We've just signed a lease for a community clinic, a county clinic in the North County, right on the Mountain View Palo Alto border. And it is literally going to be the first county clinic in my district in the 172-year history of this county. And for folks of modest means, and again, that could be folks we think of as, middle class economically or the working poor. It's just a huge opportunity, I think, for us to do right by them. And now I've turned my attention to seeing if we can identify a site in the West Valley communities. I represent 4 of the 5 so-called West Valley communities: Saratoga, Los Gatos, Montessorino, and Cupertino. Campbell is represented by one of my colleagues. But again, no county presence in those 5 cities and towns. And while they are prosperous communities, there are folks in those areas who, again, come up short when it comes to access to health care. Had a really wonderful idea tossed my way, and I want to give credit where credit's due. Patrick Ahrens, who's the president of the Foothill De Anza Community College Board, said, our demographics are changing. We are doing some major redesign on our De Anza campus in Cupertino. Have you thought about a healthcare center there, a clinic there? And I hadn't, candidly, and we started to pursue it. And I think it makes all the sense in the world. The De Anza clinic, for those who don't, the De Anza Community College site, for those who don't know it. See, I'm already thinking of it as a clinic. The De Anza Community College site, for those who don't know it, is very easy to access off Highway 85 and 280. There again isn't a county health clinic anywhere in the immediate vicinity. The students on that campus, many of whom are struggling financially, they may be food insecure. They may think they're among the young invincibles who don't really need health insurance, but do. It's not just a question of serving, the tens of thousands of students there, but we could serve the entire surrounding community and create some very interesting educational opportunities for students who are in the health services world at the Foothill De Anza college system. So a world of opportunity. But back to your question, what does access mean? Well, yeah, it means affordable. It means quality health care. And it also means, is it just geographically accessible? For a lot of folks, getting to our Valley Medical Center here as an example, if they are in the northwest part of the county, that's a struggle. And if that impedes them, if that limits them, if that discourages them from getting the health care that they need and deserve, I think that's got to be a concern.
Well, me personally, I live in Cupertino, so it's really heartening to hear that you are such a champion for expanding access and really just making sure that people have, of course, geographic access as well as financial access as well. So I love that.
Well, for your listeners and viewers who remember the American broadcaster Walter Cronkite from the television news years ago, he had a marvelous saying that I came across, which was, I don't know why we call it a healthcare system. It isn't healthy, it isn't caring, and it sure as hell isn't a system. And I remember at the time thinking, okay, that should sort of be top of mind whenever I'm looking at these challenges. It's about keeping folks healthy. It's about doing that in a way that is caring, and it really should be a system that people can access easily and know that whatever they need, wherever they need it, they're going to be able to find it. Because as my grandfather said all those years ago, without your health, you got nothing. So you want to make sure that that's available for everyone. It's not a nice to have, it's a have to have. And I think we need to look at it that way. And it's one of the things that's so, satisfying about working in the county's healthcare system is that we're here for everybody.
again, it just sounds like you have such a heart for the community when it comes to things like this. And I'm sure you have for a very long time. And so we talk a little bit about expanding coverage, getting new clinics in areas and things. What is the process for expansion and identifying the need and identifying where these things can go?
Well, in a perfect world, that would be a place we don't live or work. In a perfect world, everyone would have access to top flight health insurance. And, there's this larger debate that continues to play out about Medicare for all, single payer. But in the meantime, we've got folks who need healthcare now. And so one of the things that I focused on when I came back on the board 10 years ago now, hard to believe, is, all right, what do we do to get more folks health insurance? And one of the reasons I was so enthusiastic about serving on the county's Health and Hospital Committee, which I now chair, was that I came back just in time for the arrival of the Affordable Care Act and Obamacare, as people refer to it colloquially. And I thought, there's an opportunity here. It's important that we do this right, that we do it well. And there's also an opportunity to make sure we expand access, back to that word again. And, we were in the high 80s in terms of percentage of the population that was covered, and now we're at probably 95, 96%. And, those are just numbers, but, you start to realize you're talking about, tens of thousands, 100,000 plus folks who are now, going to go off to work every day, we hope, or tuck their kids in at night and know my family is safe and secure. That's not a small thing. And so trying to make sure that those products are out there. And then if there isn't an insurance product that works for them some way, or if we just can't get them to show up and, go through the exercise, we got to have a product that makes sure that they're still going to get the health care they need, and including preventative health care. People in the healthcare arena, and, this is your world and my world, understand that preventative care is really where you want to be, because it's not only the best kind of health care for people, but it's also the least expensive ultimately. But, for too many people, if there's no access, or it's not affordable, or they don't have insurance, or they don't know that there's a clinic where they can just show up and get the care they need, they put it off, and oftentimes with disastrous consequences. So, I'm always looking for partners because we haven't had county clinic in my district. It means we partner with Mayview, now operated by the Ravenswood Clinic, and that community clinic network is just indispensable to things that are essential to my constituents. Same with Planned Parenthood. For a while, we were concerned that Planned Parenthood, who has an office and clinic in Mountain View, was going to be unable to stay in the North County location because they lost their lease, a fairly common story in our area. And ultimately, working together with them, one of those things that I would say turned out exactly as we planned, except totally the opposite, which is we thought, well, maybe we should lease a building, turn it into a county clinic, and sublet some space to them. They actually ended up saying, no, what we'll do is we'll lease a building, or buy a building actually, and then now they sublet to us, so or lease to us, and we provide pharmacy and complementary services. And I say complementary because we obviously don't want to compete with Planned Parenthood. What we want to do is supplement. We want to provide care that maybe is not something that they can provide to their patients. Dental care is another one where, I think a lot of people think of healthcare and then think of dental care as somehow separate or apart from that. Not so. Dental care is a key part of healthcare. And so we've got clinics now, again, in the North County where particularly for folks of modest means who don't have access to quality dental care, there's a place there for them. So it's, as I say, it's about cost, providing a program. We've got a million acronyms in the healthcare world. I find them confusing. I can't imagine how hard it is for folks who don't work in the field. I sometimes say, look, if I've been sitting on the county's Health and Hospital Committee for a decade now and chair the committee, and I'm struggling to understand some of the bureaucracy and the acronyms, what's that like for just a member of the public who's trying to keep themselves well and their family? But we've got a program now called PCAP, which is there for folks who still don't have health insurance for one reason or another. Perhaps they can't access it for financial reasons or because they're undocumented. And we want to know if they show up, they can get the health care they need. So it would be nice if we could just, make it a one size fits all, but we can't. And so we don't. And I think that's important. People understand that there's something out there that will work for them if they need the help.
And it has been just phenomenal to see many of these groundbreaking ceremonies and ribbon cutting ceremonies for all of these new facilities that have opened through collaborations, through hard work on your behalf and so many people in the county. And it is definitely not without a lot of hard work and care for the people of the community, which I see is definitely top of your mind.
Well, Nick, you mentioned in passing, other folks. There are 23,000 people at the county. And I am acutely aware of the fact, one of my colleagues actually did a nice job of referencing this recently. Look, I can push, and I do. And I have a pretty determined side, I'll put it that way, when I feel like we're not getting help to people who need help. But I am acutely aware of the fact that unless we can engage others in the work, I'm just a guy at a microphone sharing a thought. So, I need to take this opportunity to give a little bit of a shout out, some kudos to people in our health and hospital system and people in the community who, really deliver on a day-to-day basis under very difficult circumstances sometimes. There can be community opposition to citing a clinic or a facility. There can be political opposition for some reason. There can be financial challenges. There can be organizational challenges. But the understanding that's out there of just how important these issues is the starting point. And that's why I appreciate the opportunity to make the case.
Well, I know that for people who are listening to this episode and maybe getting the chance to hear you talk for the first time, hopefully not the first time, but it's just going to be very apparent of all of the ways in which you and so many thousands of people care for them, whether they live in a place that is close to a healthcare service or not. They're going to know that one is hopefully on the way or why one is there and what it took to get there. Is there anything else that you'd like to share with the public today?
Well, I know we're going to have a chance to talk again soon, but I do think for folks who are thinking, what about mental health care? We should just take a moment to say, absolutely. And to be very clear, mental health care is health care, period, full stop. Drug pricing, an issue that our federal and state governments have struggled with, frankly, not terribly successfully, and we have tackled that here at the county in a way I hope we can talk about at somewhat greater length another time. But all of this is about making sure that we keep folks well and that they can realize their full potential personally and professionally, and whatever it takes to make that happen for every resident of Santa Clara County, that ought to be the mission.
You said two more huge things, infinitely important: mental health care and access to affordable medicines. And Supervisor Joe Simitian, we will absolutely have you back to talk about those things. And we thank you for coming on The Beat today.
Thanks a million, Nick.